here with another video, and it's entitled What's in My Nursing Bag? Alright guys, so I saw this video concept from another nurse that I follow, and I thought it was really cute. So I said I was going to duplicate it because the best form of flattery is imitation. Okay guys, so this is my nurse bag that I use. Yes, I know it's not your traditional nursing bag, but it's what I'm using now because my personality is a little flashy. So I got a Victoria's Secret pink bag. This bag is literally like 99 cents, and I am actually using it for way more than what it's really worth. So, or more for the price, because it is worth a lot. All right guys, so the first thing in my nursing bag is my clipboard, and it's a nice little orange clipboard. And basically it's really important when you do work that you have a clipboard for your papers, because with me, I work at the hospital and I usually have 5 to 6 patients each night because I do work night shift. And we do a thing called patient report, where the paper has like all the patient's information that's important to the nurse that we need to know during our shift. And it's something where we can clip the papers in, we can flip through them, and we just have them for us. So this is very important for all of the new nurses who will be graduating in 2020. Okay, so that's the first item that I have. The next item that I have, which is pretty important, is my stethoscope case. It's really cute. I got this from a job that I worked at previously before this job for Nurses Week, and it's very comes in handy. I can put my stethoscope in it, and when I'm ready for it, I take it out. And this is a Littmann stethoscope that one of my best friends got me for my RN graduation, which was 4 years ago, almost to this date. And I use it a lot. I really love it. I've had other stethoscopes in between, but this is my favorite because it's my favorite color and I really like it. Okay, so the next thing in my nursing bag is this book. Because right now I'm currently studying for the nurse practitioner's board exam, and so I do work night shifts, so we do have some downtime during those wee hours of the morning. So after, you know, I've done everything and got all my documentation done and everybody's nice and good and relaxed, I open this sucker up. And it's actually been working well. I'm going to do another video about this book, a review of it, as well as of another Fitzgerald book that I'm studying from right now in a later video, but it is in my nursing bag and I really like it. All right, so speaking of downtime, another thing that another book that I have is The Help. I know this book is old, this movie is old. It came out, I think, in like 2011 and 2012 or something like that. But right now, you know, during quarantine, I'm catching up on some much needed reading. I really do like reading. It was really one of my favorite pastimes. I love, you know, getting lost in novels and, you know, let my imagination do its thing. So this is another book that I have in my nursing bag for some of the downtime. Okay, so the next thing I have in my bag is my pin light. Can you see me? Can you see me? Looks like the battery's not working, but this is another good item to have when you're doing a patient assessment. You're looking in their eyes, or you're looking, you know, at different like skin abnormalities or something like that. This does come in handy. It's also really good to have in nursing school, so it is a good thing to have in your nursing bag. All right, so the next thing I have is just a I like to try to keep a just a scrap like notepad just to have, because a lot of times, you know, you want to write things down, you may forget things, then it might be a busy day and stuff like that. So I always keep this like in the pocket of my scrubs, just to, you know, if anything changes or if I have to call the doctor. I'm a note taker. That's another thing. When I'm studying, I take a lot of notes, so it's always good to have a nice little notepad with you. All right, so the next thing I have is some gum. You know, 12-hour shifts can get a little rough. You know, you're eating, you're snacking and stuff like that. You're drinking coffee, in my case, because I work overnight and I need to stay up. So your breath can get a little offensive. So I don't want to offend my patients with hot dragon breath. So I keep my extra gum in my bag, and we're all good. So the next thing I have in my nursing bag is my ID. It's just in there. I mean, I wear it on me when I'm at work, but this is my ID, and it shows that I am an RN BSN. If you can't see, you see now. And so yes, and I'm very proud of that. Next thing I have in my nursing bag is my peach mango hand sanitizer. I got this from Bath and Body Works. It smells really, really good. And you know, during COVID-19, you want to keep up with your hand sanitizer. I actually have more than one. I actually have 2 different hand sanitizers. We do have hand sanitizer dispensers all over the place, but a lot of times, you know, those hand sanitizer dispensers, they have stuff on the outside of them. They have germs when you're touching it. So I'd rather just carry around my own. So I keep these in my pocket at all times, or, you know, they're always in my bag, but I keep it in my pocket at all times, just to make sure my hands are clean, as well as washing them constantly. So that's very important. So if you have hand sanitizer, your hands are going to get dry, they're going to get ashy, and they can eventually crack. So I keep my handy dandy lotion in my nursing bag because I want to keep soft, nice hands. So I have another Bath and Body Works lotion here. And I mean, it can be debatable as to the facilities, whether, you know, to wear, you know, like loud or perfume scented lotion, but I don't use too much. I use a little bit just to kind of like wet my hands and, you know, go over it. And, you know, I just keep it around because cracked, ashy hands is not the business. All right, guys. So the next thing is I have some pens and a marker. These are very important. Pens. People steal pens. I'm just going to say nurses are very notorious of stealing pens. So you guard your pens with your life, nurses, because there's nothing like not having a pen at work when you have to write some notes down or write some things down, or, you know, something changes and you have to go back to that pad and change stuff on a patient's paper chart. Keep you some pens. And dry erase board marker. Keep this. You have to update your dry erase board in the room with the patients. It's very important. You have to document your time. You have to document when the next medication dose is due, when anything changes or anything like that. So you really need this, and be nice and pass it on sometimes if you don't need it, or if you like leaving your shift or something. But usually they have them in the tap out rooms. So I keep my stuff. I'm just saying. Okay, guys, so the next thing is just miscellaneous things, really. Of course, I have my wallet that I always keep with me. It's Michael Kors. Yes, I love Michael Kors. Okay, yeah. You know, sometimes it gets rough and sweaty and hot. I do have some deodorant in my nursing bag because I will not be that smelly nurse that offends people with body odor. So you're going to have a good smelling nurse. I do have my deodorant. Then I also have my glasses. What I like to do, I'm weird because my glasses are like, I have one eye that's like 20/20 vision, and then I have another eye that's like 20/80. So technically this eye corrects this eye, but I still like to wear my glasses, especially at the hospital, because you never know if something, you know, fluid kind of flicks in your face or in your eyes. So this is basically like another safeguard, like how gloves are, or you know, a hair net or something like that is a safeguard for you. So I wear my glasses and I think I look cute in them, you know, like a sexy school teacher or nurse. I don't know. I am a nurse, right? All right, guys, I'm being silly. So the next thing I do also have is a phone charger. This is very important in the hospital. People are always looking for a phone charger. Don't laugh at my charger because this one is like slightly broken, whatever. But do not let your patients borrow this because they will go home with it. Or either some of your nursing friends can go home with your iPhone charger. And this is the original, like actually with the phone that comes with the phone. So I'm not partying with this. Y'all can't borrow this. Y'all gotta have your own. I'm sorry. All right, guys. And so next thing is I have some earphones. Like I said, like walking into work or walking away from work or on my break when I want to listen to some music, I'll pop these in my ear and I'll listen to some tunes, uplifting tunes or something like that. So that's another thing. And then also too, I got to keep myself right when I got my hair together. So I keep a comb in my bag. Okay. Sorry. You know, I can't be walking around looking crazy. So I'm keeping a comb in my bag. Okay. Okay, guys, so next thing that I have, it's really important nowadays. I have a mask. I have my mask. This is a surgical mask, and it is for specifically droplet precautions, and I have to keep this on at all times. Now, you know, they're always saying, you know, nurses are superheroes, we're frontline workers, and all my frontline workers, I better not see you not having this on in your shift. The only times you better have this off is when you're taking your lunch break and you're eating, because we don't have a slit for the mouth, okay? So this is definitely in my nurse's bag. We have a par room, so we continuously, like, you know, have them new ones so we don't have to reuse the old ones, but we do have this. Also, there have been some really, really sweet people who've come to the hospital and they've made these homemade masks for us. And this is one of them. I think this is really, really cute. I love this. I love these colors and stuff. This is another one that I really like when I go out in public. A lot of people are always like, oh, where'd you get that mask from? I'm like, oh, one of my patients' family members made it and stuff like that. So these are really, really crucial and important. I really love these. And these are cotton. So I just wash these out after each shift and I can reuse them. But the other ones, the surgical masks, I you know, discard them, as well as, you know, we do wear N95 masks sometimes, but if you're not directly working with COVID patients, they're not required. But I would say you always have to wear those surgical masks because they really, really protect you. Okay, guys, so that basically is all in my nursing bag. I'm pretty much a minimalist, and that just basically means that what's in my nursing bag is what's essential that I need. I don't really have anything that's non-essential because I'm not going to be carrying a big old bag all the way up these, you know, up those stairs and from that parking lot to the front door. So I'm going to keep what I have in my bag down to a minimum. So guys, if you guys want to see more videos like this, let me know. Just comment below if you like this video. Let me know. I plan on doing more videos that are entertaining, like some skits and stuff like that, and also some educational videos talking to you about different illnesses, diseases, as well as, like I said, I'll be doing reviews of those nurse practitioner review books that I'm using right now. As well as, guys, guess what? I'm graduating tomorrow. Woo! I'm graduating from my nurse practitioner program. It's been a long 3 years and I'm just really excited. Unfortunately, it's not going to be a walking across the stage. This is going to be a virtual graduation, which a lot of our 2020 grads are having, which is, I mean, better than nothing. You know, we're getting our we're gonna not do justice, so I will, you know, just post a little something about that, a little, probably Saturday. So that's, you know, coming up. But I really want to say thank you guys for watching. Please subscribe, comment, like, share. Also hit the notifications bell so it can tell you when the next time I will be bringing you guys another video. All right, well, peace, love, and make sure you are wearing your mask. I don't care what they're saying about reopening everything up. We need to wear this mask, okay? All right, guys.